Good morning, good afternoon, and good evening to all of you who are joining us for this webinar, Advancing Fiscal Policies for Public Health. Welcome. I'm Lucy Martinez Sullivan. I'm the Senior Vice President at the Global Health Advocacy Incubator, and I'm thrilled to be moderating today's discussion on the power of fiscal policies for public health. Today, we'll be discussing the importance of excise taxes to raise the prices of health-harming products, including tobacco, alcohol, and sugar-sweetened beverages. These taxes reduce consumption, prevent disease, save lives, and raise revenue for government investments. For those who may not be familiar, the Global Health Advocacy Incubator supports civil society advocates around the world as they fight for life-saving public health policies. And we work on public health issues and political systems that are diverse in order to provide strategic and technical support to our partner organizations. Before I begin, I'd like to invite everyone in joining us to introduce yourselves in the chat box. There will be time for questions and answers toward the end of today's session. So if you have a question that you'd like to pose to our speakers, please feel free to ask it in the Q&A section of the Zoom toolbar. I'd also like to let everybody know that this event will have simultaneous translation into Spanish and French. To access the Spanish and French audio channels, please click on the globe icon in your Zoom toolbar. Also, please note that the webinar will be recorded. So again, please feel free to introduce yourselves in the chat box and welcome. So I'd like to start out by introducing our first speaker. Our first speaker is joining us by video, by pre-recorded video remarks from the Philippines, and he is Karl Chua. He was most recently the Undersecretary of the Department of Finance in the Philippines, and as the chief economist of the Strategy, Economics, and Results Group, he gave policy advice to the Duterte administration's economic team. In 2017, he got the nation's attention when he vigorously defended the passage of a controversial Tax Reform for Acceleration and Inclusion, or TRAIN Act, which he himself helped craft. And previously, Chua worked at the World Bank office in Manila, where he rose from research analyst to senior country economist. And so without further ado, I will turn the floor over to the video from Karl Chua.
Ms. Lucy Sullivan of the Global Health Advocacy Incubator, Mr. Omei Bongos of Gatefield Impact, Ullah Ghumman of the Pakistan National Heart Association, Global Health and Development Organizations, philanthropy and advocacy groups, government officials, and participants of the 75th World Health Assembly. Good evening. I am honored to share with you the Philippines' experience in pushing for excise tax legislation on tobacco and alcohol products. Our efforts to reform sin taxes can be traced back to the previous administration. Through Republic Act number 10351, or the Sin Tax Reform Law of 2012, we restructured the excise tax on tobacco and alcohol products. Under the Duterte administration, the Philippine government pursued the comprehensive tax reform program to make our tax system simpler, fairer, and more efficient. Thus, this included Package 1, or the Tax Reform for Acceleration and Inclusion Law of 2018, which increased taxes on tobacco products and introduced a sweetened beverage tax. Later on, we further increased taxes on tobacco and alcohol products and introduced a new tax on e-cigarettes through Package 2 Plus when our previous hikes proved to be insufficient to curtail consumption. All these taxes have helped fund the universal healthcare law to give every Filipino access to more comprehensive healthcare services. Despite the resistance from the alcohol and tobacco industries, we succeeded in implementing our sin tax reforms, in part due to the effective collaboration between the government and private citizens and top-level ownership of the reform by the President and the Cabinet. In particular, civil society organizations played a key role in building multi-stakeholder coalitions that advocated for the reform, shaped public perception, and ensured the accountability of legislators. Most importantly, the President's strong support for these healthcare measures and tax measures allowed us to vigorously push for these reforms in Congress, as they were clear priorities of the administration. These early reforms helped strengthen our macro fiscal foundations and served as our insurance during the COVID-19 pandemic. The Duterte administration's comprehensive tax reform program enabled the Philippine government to fund billions of emergency cash transfers, procure millions of life-saving vaccines, and increase our investment in health and social services. Our experience has highlighted the strong interplay between fiscal policies and social interventions. We fought hard to enact these game-changing tax reforms, and now we are seeing their benefits. We remain confident that the bold policies we have instituted over the past 6 years will further drive our economy forward and help improve the lives of our people. Thank you very much.
Thank you for that terrific introductory set of remarks. And now I'm going to move to introduce our two speakers today. They will provide remarks and reflections based on their experiences with excise taxes in their countries, and then we'll move forward on in a conversation with our two panelists and open it up for Q&A. So first we have Omei Bongos. She is the Communications Policy and Governance Specialist at Gatefield and in Nigeria. Before joining Gatefield, Omei worked with the Society for Family Health, where as a member of the National Advocacy Communication and Social Mobilization Committee, she developed a behavior change communication strategy for the Global Fund Malaria Program. Omei holds a master's degree in global health promotion and is a Writer's Digest certified copy editor. Next, we have Sana Ullah Ghumman. He is the General Secretary of Pakistan's National Heart Association. He's an alumnus of the University of Punjab in Lahore, Pakistan, and he started his career as Pakistan's National Heart Association's Director of Operations. The Heart Association was established in 1984 to promote public advocacy for the prevention of heart disease and to train people in cardiopulmonary resuscitation, or CPR. Mr. Ghumman has been granted the Pride of Performance Award by the President of the Islamic Republic of Pakistan for his numerous activities for the welfare of Pakistani people. Welcome, Omei and Sana. We're so glad to have you here today and very much look forward to your remarks. So Omei, we're going to go ahead and start with you. Would love to hear a bit about your experience with excise taxes in Nigeria.
All right, thank you so very much, Lucy, for that kind introduction. And it's wonderful to be here. I'd like to thank the Global Health Advocacy Incubator for hosting this session and for inviting me to be a speaker. Thank you so much. It's nice to be here. So as Lucy said, I will be speaking on my experience at Gatefield, on how Gatefield contributed to getting Nigeria's sugar-sweetened beverage tax passed just as recently as last December 2021 through the country's Finance Act. I'll also be talking about how civil society can help to advocate for excise taxes and other fiscal policies on health harming products. So, well, first of all, why do we need fiscal policies for public health? In recent times, just as Karl mentioned, the world has been hit by the COVID-19 pandemic. Many countries suffered from adverse economic fallouts. Many countries suffered also the increasing in having their health sectors stretched. But in Nigeria, before COVID-19, where I live in Nigeria, our country was already in the throes of a revenue crisis because we had a growing national debt. And because we depend a lot on oil revenue, we were making not so much money from oil anymore because the revenue from oil was starting to drop. And during the COVID pandemic, we reported almost 300,000 cases. And adding to this, the increasing burden of non-communicable diseases in the country, And Nigeria has the highest diabetes prevalence on the African continent, for instance. So our healthcare system was stretched and it continues to be stretched. And so as the country contemplates the road to economic recovery, it became clear that the time had come to seriously consider additional revenue sources for financing healthcare. Nigeria's healthcare spending is very low. So to put it in context, the federal health budget is about $1 billion. But that's not a lot of money at all. $1 billion. I'm not sure how much, for instance, the state of New York spends on healthcare, but $1 billion for a country of 200 million people is not nearly enough money. And so healthcare spending amounts to around $6 a person a year from the government. So out of pocket spending for healthcare in Nigeria comes to about 80%, just above 77% of healthcare payments. So we can see that taxes on health harming products can significantly contribute critical revenue to the health system and to healthcare financing. And Nigeria is the world's 7th highest consumer of sugary drinks. And in 2019, it was reported that we recorded the world's 4th highest sales by volume of sugar sweetened beverages, nearly 40 million liters in a single year. So raising taxes on sugar sweetened beverages and other health harming products, it gives the opportunity to raise revenue that can be earmarked for health. And increasing health spending would be not just spending, but it will be an investment that offers high returns in the form of greater human capital development and economic growth. Health harming products are costly to society. And so with taxes, they can shift from this cost and they can take from this cost and produce a shift in consumer behavior. So I also mentioned that I would like to talk about Gatefield's experience and how we advocated for a tax policy, considering Nigeria's experience here and where Nigeria was. In 2019, the finance minister made a remark to hint that the government was possibly considering a tax on sugar sweetened beverages. And when we considered this remark, it wasn't made in public, it was made during a meeting, a high-level meeting. But this signaled two things for us. It signaled political will on the part of the government to fund to start a tax sugar sweetened beverages as a way to raise additional revenue for the country. And it was also an opportunity for us to begin policy advocacy towards making this tax a reality and towards pushing for revenue from this tax to be channeled towards healthcare financing. And so in April 2021, 10 health civil society organizations in Nigeria came together at an inaugural meeting to call on policymakers to implement a sugar sweetened beverage tax. We had organizations like Diabetes Association of Nigeria, Nutrition Society of Nigeria, and also some media organizations like Nigeria Health Watch, which is a very big health media-focused health organization in Nigeria. So we came together at a meeting, and we outlined 3 policy recommendations. The first was to pass a tax on sugar sweetened beverages. The second was to earmark those taxes toward healthcare financing, and the third was to possibly see about front of package labeling and mandatory health warnings on sugary drink packaging. So those were the 3 things, the 3 policy recommendations that the coalition was trying to focus on. And we named our coalition National Action on Sugar Reduction. So with time, we sort of narrowed our focus to the passage of a tax, passing tax on sugar sweetened beverages. That was what we started to aspire to. So what we found was that through this coalition, coordinated advocacy action became possible. It was possible for us to focus on making a call for a tax. And even though we're a small coalition, speaking through a single unified voice amplified this call for a tax. And we applied a lot of public communication and advocacy campaigns. because we know that public communication and advocacy can raise support for health policies by increasing public knowledge and changing attitudes. So our efforts were both policymaker focused and public facing. So we had a lot of communications that were targeted at policymakers and at the public. So, but because our primary target audience was the policymakers, we used plenty of media engagement to magnify our policy recommendations. And it almost became very stale, very familiar, having our call for action through particularly the newspapers. And in all media engagement, our coalition, rather than a single organization, was the face of our advocacy. And we know that, during our stakeholder analysis, we understand that Nigerian legislators get much of their information from newspapers. And so we developed a large media contacts registry and equipped journalists with information to aid their news coverage. We had media roundtables and regular op-eds, articles, press releases. They kept our coalition, the National Action on Sugar Reduction, it kept our coalition and our message in public view. And so in just under a year, we recorded more than 100 distinct media impressions in newspapers and on TV and radio. And this helped to keep the issue high on the public agenda. In fact, a friend of mine who works at Coca-Cola said, oh, he's going to call me. He's going to call me and have a conversation. We need to have a conversation that you see what our coalition has been doing. And he said that that's fine, he would like to learn more about our work, even though he's on the opposing side, but he's just a friend of mine. And so this issue was kept high on public agenda and on both sides. And even though we received a lot of negative attention, we received a lot of pushback from the beverage industry. We kept the issue high on the public agenda, and the finance minister and the stakeholders, knowing that there was a large following, a large voice behind them, this helped to shift public perception in favor of a tax. And indeed, when we had a public perception survey, we found that more than half of Nigeria supports a tax on sugar sweetened beverages if funds are earmarked towards healthcare financing. And so we found that an important advantage of working through a coalition is the opportunity to leverage the different strengths and connections of each organization. Our coalition included, as I mentioned, Nigeria Health Watch, health-focused media organizations that help to boost our media engagement. We worked with NOI polls to generate evidence in support of attacks. And we even worked with a cancer support organization, Project Pink Blue, to have community mobilization to raise public awareness of the issue. And our networks also facilitated the bringing of the motion before the National Assembly and urged action towards attacks. And the ensuing media attention and the support of our motion sponsor, who was a public figure, it aroused further stakeholder and public interest on the issue. And one thing that we found that was also helpful was leveraging World Health Days. On World Diabetes Day, we held a public lecture, and this lecture helps to launch new stakeholder relationships and garner wide media coverage, which culminated in an open letter signed by coalition members and partners to the Minister of Finance. And this letter was published in a newspaper, in a national newspaper that's popular with decision makers. And for us, I think it was a turning point. It was a strategic advocacy move that got us the attention we're looking for, because less than 2 months later, through the Finance Act, the sugar sweetened beverage bill was signed into the Finance Act, was signed into law. And so what I'd like to end by saying is that an important role that civil society can play is turn political opportunity into a process of advocacy. When the Minister of Finance first hinted at the possibility of a tax, it signaled the presence of political will, which was an opportunity. And what turned political will into actual policy was the effort of civil society advocacy, public communications, and this provided evidence for the importance of this intention that the government had to start taxing sugar sweetened beverages. And so we framed the government's policy intention as something that was crucial, and we embarked on strategic activities that consolidated this opportunity and helped to deliver Nigeria's sugar sweetened beverage tax. And of course, we couldn't have done it without the help of the Global Health Advocacy Incubator. So I'd like to thank everyone for listening, and of course, thank the Global Health Advocacy Incubator for making it possible for us to engage in all of this. Thank you so much, Lucy. Over to you.
Thank you, Omei. That was excellent. I appreciate the tour de force that you gave us in terms of presenting the problem, given the high levels of consumption of sugar sweetened beverages in Nigeria and the relatively low spending on health. So I think those figures are really important to understand the context. And I do want to pick up on a lot of what you said regarding the advocacy and the role of the small but mighty coalition that you put together later on as we move forward on our discussion. But I want to turn to Ullah Ghumman, the General Secretary of Pakistan National Heart Association, to hear from him about the experience there with excise taxes and the role that they play in reducing disease and the disease burden. Thanks. Over to you. Mr. Ghumman, you are on mute, so please unmute yourself. Thank you.
Thank you, Lucy. Thank you very much. Dear audience, ladies and gentlemen, it's my immense pleasure to be the part of this important virtual event, the role of civil society in advancing fiscal policy for public health. I shall briefly talk about how and why civil society organizations can advocate for the implementation of excise tax for tobacco and sugary sweetened beverage, along with other fiscal policies. Let me start with a brief introduction of my organization. Pakistan National Heart Association, commonly known as PNA, was formed in 1984 under the patronage of President of Pakistan as Patron-in-Chief. PNA original aim was to raise awareness on ischemic heart diseases, risk factor, and to prevent, minimize, and control the morbidity and mortality caused by the heart failure and attack. This aim has evolved to include significant advocacy work related to prevention of non-communicable diseases. The association has worked closely with key policymakers for shaping and reforming policies to prevent non-communicable diseases. I'm sure you will be interested to learn more about PNA's story, and it will be helped understand the role of civil society organization to advocating for excise taxes on tobacco and sugary sweetened beverage and other fiscal policy for health. We created a strong coalition with civil society organization, UN agencies, Diabetic Association of Pakistan, Nutrition Society of Pakistan, Health Services Academy, National Commission on the Right of the Child, Ministry of the Health, Pakistan Medical Association, Pakistan Cardiac Society, and many others in the list. This coalition is growing every day, and news advocates and companions are joining hand with us. Recently, federal tax ombudsman joined our coalition. We achieved our first policy victory when government reverted back the third tier of tax on cigarette in 2017. The third tier was unfortunately created by the government on the recommendation of tobacco industry. It provided opportunity to tobacco industry to manipulate taxation process and enjoy tax evasion. Our work started with filing a petition, advocating with policymakers, and building pressure through civil society and media. The government finally decided to revert back the third tier. And it was the benchmark for my presidential award, Pride of Performance. With our efforts, the health levy bill was approved by the cabinet in 2019, levying tax on sugar sweetened beverage and cigarette. However, the bill went to a dormant mode due to the extensive pressure of the industry on the policymakers. You can imagine how industry is powerful and influential in the country. So the situation was disappointed, but we did not give up. The PNA filed a petition to Federal Ombudsman against the Federal Board of Revenue and ultimately achieved victory in the petition. The Federal Board of Revenue agreed to progress on the bill. They sought an opinion from Ministry of Law and Justice, and the bill was sent to the Ministry of Health for revision of the draft and to fix the earmarking of the collection revenue. The Ministry of Health revised the bill to cover wide range of sugary sweetened beverage and tobacco, and ensuring that the collected revenue is earmarked for the health promotion. The Ministry of Health submitted the summary of the bill to the cabinet. A high-level ministerial committee was formed by the Prime Minister of Pakistan to finalize this bill. At that time, Ministry of Health recommended that PNA to be the part of this high-level committee. The bill was about to be finalized, but unfortunately, the government was dissolved in the country in early April 2022. And new coalition government has taken over. This also provides us a lesson that it is important to remain flexible and account for these unexpected shift in political power and opinions. We did not give up. Parallel to this, we continued working on increasing federal excise duty on sugary sweetened beverage and tobacco product. We submitted a strong proposal to Federal Board of Revenue and Ministry of Finance to increase the federal excise duty on wide range of sugar sweetened beverage to minimum of 20%. Our proposal was for tobacco asked for 30% tax increase. Our coalition endorsed the proposal and issued support letter to Prime Minister, Finance Minister, and Chairman FBR and policymaker in the process. These efforts were coupled with a strong communication and advocacy campaigning by using digital media platform, print and electronic media, seminars, dialogues, and international visit to key policy makers and influencers. The finance bill is about to be presented in the National Assembly. Our fingers are crossed and we are hopeful for another policy victory. Finally, I take this opportunity to thank CTFK and Global Health Advocacy Incubator in country and global team for their support and guidance to our work. We look forward to continue working together to achieve a broad scope of health policies to reduce consumption of tobacco and sugary sweetened beverage. Thank you very much for patience.
Thank you so much, Sana. That was very interesting in understanding the context in Pakistan and all the lessons learned from the advocacy to pass sugar sweetened beverage taxes. So we're going to have a conversation now to go a little bit deeper. in the experiences in Nigeria and Pakistan, and talk about lessons learned. And this event is, of course, happening around the World Health Assembly, where there has already been discussion on the part of the Secretary General and others around a paradigm shift, the need to increase financing for health, the prevention of disease, and the promotion of health for all. And we know that health budgets still globally remain quite low, and more investment is needed. And I'm interested to hear from both of you the arguments used, the messaging that you used to convince policymakers and grow public support for the passage of taxes. And if you can each speak a little to that, and then I'm going to ask next about the industry opposition that each of you have encountered, and to talk a bit about that. So first, I'd like to start with you, Sana. Perhaps you can share a bit more about some of the successful messaging that started to move the needle in terms of political and public support. Sana, would you like to come in on that? Can you hear me? Okay, Omei, let's start with you then.
Hi. Okay. Yes.
Yes.
As I mentioned, we had a strong communications portion of the campaign. We started off with digital advocacy, social media, and of course media engagement. But some of the messaging that we used, particularly the public-facing messaging, had to do with the so to speak, like the real cost of a bottle of soda, for instance. We talked about how soda is affordable, soft drinks are affordable, sweet beverages are affordable, but then in the long run, the cost of the health effects that they result in add up to so much more than just the cost of a bottle. One thing that we did, we had a documentary which featured people living with diabetes, two women living with diabetes, and one woman in particular mentioned how she had to sell her household items to keep up with her diabetes medications, just to keep up with the cost of diabetes medication. So that kind of messaging that appeals to public, not just policymakers alone, but to the public, how to help people understand, what is the real cost of a bottle, and it adds up to so much more than just that. And knowing that a tax, if funds are and tax revenues is earmarked for health purposes, revenue can be directed towards healthcare financing programs that benefit the poor in particular. So that's just more the messaging that we used to shift public perception towards a tax.
Thank you. That's so interesting that you talked about the true cost of a bottle of sugar sweetened beverage and made it personal, and really tapped into sort of the emotional piece of this issue. Sana, hopefully you can hear me and you can address the question that I had posed around what key messages really resonated with policymakers or the public, or were successful in helping to build support for excise taxes. Yes, please unmute yourself.
Yes, thank you, Lucy. Public and these messages are very important. We give these messages through the public, through the social and electronic media, the policymakers. Strong messages act upon, and these messages are so important for the policymakers to make the policies or to make these efforts for taxation on sugary sweetened beverage. We have very good resources for these messages to send this message to the policymakers, and we have an public survey again demand from the government to raise the taxes on the sugary sweetened beverage, and we give this message to the public, general public, through the media, through the influencer, to the law and policymakers.
Yeah. Thank you. So in terms of the potential for taxes to address gaps in public health budgets, can you speak a bit to that in your understanding of the economics of this, particularly as it relates to addressing budget shortfalls or increasing public health investments and the importance of that? Go ahead, Sana, since
Okay.
The key message remained around the health and economic burden created by the beverage and tobacco, ultimately highlighting the economic cost which country is bearing. Further, we are also focused our message to policymakers that public health is more important than corporate interests.
How about you, Omei? Public health is more important than commercial interests. I'll definitely want to pick up on that in a minute, but Omei.
Well, yeah, I mean, I'm going to pick up on it right now. Public health is definitely more important than commercial interests. Yeah, I like that line because, it's just as I mentioned, health spending is not just spending, it's an investment. And even if a country has commercial interest at heart, profits at heart, those profits, those will only come from a healthy working population. And, the potential for excise taxes as a means of addressing gaps in health budgets, they have great potential. But I think that in actuality, it will depend on how rigorously the taxes are earmarked and also the tax rate. It's possible to tax sin commodities without using tax revenue for the purposes that would best suit the health interests of the country. So, for instance, Nigeria has a tobacco excise tax of 20%, but the WHO actually recommends tobacco taxes to be 70% of retail value. And for our sugar sweetened beverage tax, it comes to around 7%, which again falls below the 20% WHO recommendation. So the real effect of closing the health gap would be felt if the excise taxes are significant enough to deter consumption and also to raise revenue that can then be earmarked towards health spending that would benefit the poor and other aspects and other parts of the society. Thank you, Lucy.
So it seems that excise taxes are a win-win, right? They reduce consumption of unhealthy products. They increase revenue to support investments in health budgets. And as we heard from our colleague in the Philippines, actually, the taxes there helped fund emergency cash transfers, vaccines, and other investments in health and social programs. So it seems like a great thing, but of course there are opponents, and I'd be interested, and I think there's some interest also from the folks joining today, to understand the opposition, what arguments are used against taxes on unhealthy products, and to understand sort of the nature of perhaps any industry opposition that you might have encountered. We can start with you, Omei.
Yeah, So as far as industry opposition, one of the main arguments from the industry is that taxes will lead to job losses, unemployment. In fact, one of the articles that we saw from the Nigerian Labor Organization and the Manufacturers Association is that, that production would grind to a halt. It was very dramatic language. Production would grind to a halt. People would lose their jobs. Factories would be empty. But we know that that is not the case. Evidence has shown in other countries that have implemented such excise taxes that people will still drink sugar sweetened beverages, which is where we know then that tax revenue is possible to be obtained. It's possible to obtain tax revenue because expenditure, people will still spend money on sugar sweetened beverages. I mean, so the arguments are not very grounded, and so of course we again counter those arguments with our messaging. I mentioned the true cost of a bottle, in addition to others, having people understand again that someone put it very eloquently. He said, people will not stop being thirsty. So, and the industry also has options. They can use the same factory to create healthier alternatives, healthier products. They don't have to stick to creating drinks that are packed with sugar. But they already have the equipment, the machinery. It can just be turned to more positive purposes. So those are some of the arguments that we have encountered, but we know that there's always a counter messaging to the industry's opposition.
Yeah, it seems it's a very common narrative, the fear of economic losses and job losses, and trying to stoke that fear on the part of policymakers. Sana, what's been your experience in Pakistan?
Industry is very influential. They threatened the government to pull back investment. They try to misguide policymakers that the high tax may cause jobless. We countered these arguments through evidence from other countries. As I said, our message to the policymakers that public health is more important than corporate interest. The tax potential is high in Pakistan. We have low allocation for health. The high taxation and beverage and cigarette can increase health allocation by government, ultimately improving the overall health of the people.
Great, thank you for that. And as we think about other efforts in other countries around the world, as advocates are helping to pass excise taxes on sugar sweetened beverage, on tobacco, on alcohol, I'd love to hear from each of you as to what advice you would give civil society organizations and advocates working to pass these kinds of revenue generating measures. Sana, we can start with you.
We use the world practices. We learn from the world experience and the world studies. These studies help us to fight with the aligned policymaker and convince the aligned policymaker in countering the tobacco industry. You know, industry is very powerful, and they are investing, they are buying the people, they buy the law and policymaker, but we are educating through these practices of the world. We present the aligned policymaker what the world are doing to prevent their people, and we learn from the experience of the world. Yeah.
Thank you for that. Omei, what advice do you have for other advocates in other countries?
Yeah, I think the advice that I have for other advocates would be some insights that we have gained as far as one thing that helped was framing the tax as a pro-health tax rather than simply as a way for the government to raise more revenue. So this made the tax more acceptable. You know, when we had a chance to do our public perception survey, which is also something that other advocates should think about. We because as stakeholders always wanted to know, where is the data? What does the data say? So when we had the perception survey, the report showed that 54% of Nigerians support a tax if funds are invested in healthcare. So framing the tax as a pro-health tax made the tax more acceptable, particularly in a society where people are often skeptical of government intentions. So public communication that elevates the welfare of the people, the interest of the people over corporate profits, as Sana said, is crucial for gaining support for a policy such as this. So clear communication and framing the tax as a pro-health tax, I think, is something that other advocates should think about.
Thank you for that. How then does the role of civil society change now that taxes are passed, or once there's been sort of this kind of policy victory? What do you see the role of civil society being?
I think civil society can now think about an accountability role. The tax has been passed into law. And then here in Nigeria, we're also waiting for official implementation to begin. So the role of civil society would be for accountability. We will continue to harness the strength of the coalition and to continue communication, the clear communication, to strengthen awareness of the tax, its importance, and also to put pressure on policymakers. You have come this far, now take a step further to make sure that the tax is implemented. So accountability, putting pressure on policymakers, and continuing clear communication to further shift public opinion in favor of tax. I think these are some of the roles that civil society can continue to play.
Thank you very much for raising this important question. The role of the civil society will always remain important. If the tax are already passed, the civil society should continue advocating for sustainability of the policy, as the industry will continue looking for relief and may put effort to revert back the taxes. The civil society can plan to measure the impact of the taxes imposed, which may be useful for public policymakers, for sustainability of the policy, or even further raising the tax if required. In addition, the civil society may expand their advocacy effort to include other policies action to reduce consumption of sugary sweetened beverage and tobacco, like front of pack labeling and warning sign, marketing restriction, removing sugary drinks from school and public institution. Pakistan imposed restriction on availability of sugar sweetened beverage and energy drinks at school through Provincial Food Authority. We are currently planning to expand our advocacy effort to include front of pack mandatory labeling and warning sign, and making restriction to reduce the consumption of sugary sweetened beverage. A package of policy is always useful to achieve greater results.
Thank you, Sana. I'm so glad you mentioned that, because in addition to the revenue raising potential of excise taxes, I think it does create a window of opportunity to continue to push for policies that promote health, such as those that you mentioned, the marketing restrictions, and creating healthier school food environments. So I think that's very smart, and the role that civil society can play in advancing those. So we have an opportunity for the audience listening in today to pose questions for you. We did get one question about alcohol taxation. We haven't talked about alcohol, tobacco, sugar sweetened beverage taxes, of course, and tobacco taxes. But the question is why we think that public health oriented alcohol taxation is not more common. And I'm not sure if you have a perspective on that you might be willing to offer today.
Okay, I guess I could.
Or, okay, go
Okay.
ahead.
Okay. Well, I mean, for instance, in Nigeria, we do have an alcohol tax here. It's a volume-based tax here in Nigeria, about 35 naira per liter. 35 naira is about how many cents now? I'm not entirely sure, but yeah, it's about 35 naira per liter, which is again, I mentioned the volume-based tax, but yeah, it's not. It's already because it's already passed in Nigeria here, and I think as far as opportunities for us here in Nigeria, there's some opportunities with the alcohol tax policy, because even though there is a harm of alcohol and a growing harm of alcohol, there is not a comprehensive alcohol control policy here in Nigeria, and it might also have to do with awareness and communications. Sugar and smoking, they seem to pose more direct dangers, or at least in the minds of people. We can think about cancer of the lungs and type 2 diabetes, those two diseases that straight away come to mind. But as far as alcohol-related illnesses and public health concerns, drunk driving, speed driving, those are not so highly publicized. At least here in our society, communications of that are not as clear as they are with the others. So I think that might be one of the reasons. So there is an opportunity here for a more comprehensive alcohol control policy that's linked to helping public health as well. So
yeah, thank you for that point. And I think it illustrates the importance of good communication, strong, clear public communication to help understand the health harms of these products. And you're right, I think maybe the case has been made more clearly on sugar sweetened beverages and tobacco. Another question that came in just now is an interesting one. We've certainly seen this in the United States on in the case of sugar sweetened beverage taxes here. What role do the taxes play in promoting any reformulation? So companies making their products less sweet, for example, or is the industry responding by trying to get the tax repealed? So what has been the industry response? We understand the opposition, but to the extent you're able to comment on any response, whether positive in terms of reformulation or negative in terms of continued opposition.
You see, the alcohol is legally banned in Pakistan, so the consumption is very low. So this may be the reason that we don't have much about alcohol, but I fully agree that alcohol consumption need be reduced through similar policy action which we use for tobacco and beverage, and we keep on struggling for that.
Great. Any comment on any industry response to the taxation, or maybe early to tell?
Tax may be useful on beverage for reformulation, but industry always create a problem. Industry is very sourceful, very impressive. They buy the line policymaker. Recently, in our recent budget, they buy our finance minister. Even our finance minister everybody was saying, cabinet was saying, prime minister was saying for taxation on tobacco and sugary sweetened beverage, but our finance minister was saying it's not suitable time for taxation on sugary sweetened beverage and tobacco, in which we asked from the finance minister, we had suitable time to increase the prices of petrol. We have suitable time to increase the prices of gas and other things, but you think it's not suitable time to increase the taxes on sugary and sweetened beverage. Really, it was due to the industry interference with the finance minister.
Interesting. Well, I think understanding the nature of industry arguments and opposition, both before the passage of excise taxes and then potentially even afterwards, what the industry response is will be important and helpful to other civil society advocates and efforts in other countries to pass excise taxes. But we're closing in on the hour, so I want to take this opportunity to thank you both, Sana, Omei, for your time today, for sharing your experience, lessons learned, and most importantly for your passionate advocacy on the part of public health. We're so grateful to you and to your colleagues and members of your coalition and all the work that you've been doing. So thank you so much for the excellent presentations. To our participants today, thank you for your attention, for your questions. We will share materials cited in today's events by email with all of you. We have a resource on the Nigerian sugar sweetened beverage tax that was put in the chat. But we would love to hear from you. If you want to learn more, please do visit our website, advocacyincubator.org, for more resources. And as I mentioned, this webinar is being recorded, and so we can share out that link once available. So I hope all of you enjoy the rest of the World Health Assembly presentations and events, and I wish you much good health. Thank you again. Bye-bye.
Thank you, Lucy. Thank you, everybody. Thank you very much.
Thank you very much, everyone. Have a lovely day. Bye, everyone.